Everyone gets worried and a little scared from time to time, but when worry gets out of hand and starts to get in the way of daily life, you might have an anxiety disorder. Here are some things you can do to deal with your anxiety and panic attacks and get your life back on track. However, before we start our countdown, we would appreciate it if you would subscribe to our YouTube channel and also press the bell icon. 1. Rule out other possibilities. The symptoms of an anxiety attack or panic disorder can be like those of other health problems or the side effects of certain medicines. Anyone who has strong or overwhelming symptoms, especially if they are new, should talk to a doctor to make sure there isn't a physical cause. Low blood sugar, an overactive thyroid gland, hormonal imbalances, autoimmune disorders, inner ear disorders, and problems with the mitral valve of the heart can look like anxiety. Someone having a panic attack might think they're having a heart attack. The first step is to make sure that they aren't. 2. Recognize that you are not in danger. Anxiety can look like general anxiety, social anxiety, phobias, separation anxiety, and panic attacks, among other things. But anxiety becomes an anxiety disorder when it gets too much and starts to get in the way of our daily lives. Panic attacks can happen out of the blue and make you feel sick, tremble, and have an irregular heartbeat. It's like when you were a child and someone held you under the water for too long. You feel like something terrible is happening. When they have a panic attack, many people think they are having a heart attack or stroke and think they are in immediate danger. They get caught up in the worst-case scenario and can't let go of it. What if I lose my job? What if my partner is having an affair? What if my child gets in a car accident? She says that even though the signs of a panic or anxiety attack can be scary, the most important thing to remember is that you are not in danger. You need to realize that it's not real. Even though you think you're going crazy, you probably aren't. Most panic attacks end in 2 or 3 minutes. 3. Breathe quietly and slowly. People who have anxiety or panic attacks often have chest pains, which are caused by breathing too fast and tight chest muscles. They go to the emergency room breathing so fast and holding their chest and stomach that they forget to breathe. Even though the attack can be scary, you shouldn't tell the person who is having it to take a deep breath. You don't want them to start to breathe too fast. Instead, take calm breaths if you are hyperventilating. Close your mouth and breathe quietly, gently, and as slowly as you can through your nose. This will raise your carbon dioxide levels and make you feel better. When people are nervous, they tend to breathe faster, which can make them feel lightheaded and dizzy. This can make them feel even more nervous. When you take 6 to 8 breaths per minute, your body knows that everything is fine. 4. Maintain a healthy diet. Dr. Cheryl says that the average person can help reduce anxiety and stress by eating a well-balanced diet. Diet can help relieve anxiety by making sure you eat healthy, well-balanced meals, stay hydrated, and cut back on alcohol and caffeine. Make sure you don't skip meals to keep your blood sugar from dropping, which can make you feel jittery and make your anxiety worse. 5. Exercise regularly. We know that exercise is good for our bodies, but research has also shown that not getting enough exercise is linked to feeling anxious. Researchers have found that running activates chemicals in the brain that can make people feel less anxious. 6. Know your triggers. Even though your genes and upbringing can make you more likely to have anxiety, certain things can bring it back or make it worse. Changes in life that happen all of a sudden, like having a baby, losing your job, or having a sick child, can cause anxiety and too much worry. What happens is that the high level of stress becomes too much, and the brain and body's alarm system goes off. It doesn't matter if it's real or not, it will still cause the same stress. For people with an anxiety disorder, a trigger can be anything that makes them feel uncertain or like they have less control, like flying, crowds, or pressure at work. For people who have panic attacks, a trigger can be any perceived change in their body. These physical changes set off their alarm system. Also, keep in mind that people have had panic attacks for no reason at all. 7. Get adequate sleep. Dr. Cheryl says that getting enough sleep and making sure you have a regular sleep schedule are important ways to deal with anxiety. He says that if you don't get enough sleep, it can affect your mood and make it harder for you to deal with stress, which can start a vicious cycle. Studies show that sleep has an effect on the brain and can directly affect your mental health. A systematic review and meta-analysis done on this topic in 2016 found that short-term lack of sleep is linked to more anxiety. In addition to making you feel more anxious, not getting enough sleep throws off your hormone levels and makes you produce more adrenaline, both of which can make you feel even more anxious. Not getting enough sleep makes you cranky, makes it hard to deal with problems, and makes you stressed, which makes it hard to sleep. 8. Consider cognitive behavioral therapy. No matter what kind of disorder a person has, it is important to learn how to deal with their fears. CBT can help people accept that they will feel anxious and that if they face it enough, it will get better. Research has shown that CBT is a good way to help people with anxiety. There are two sets of strategies used in CBT. The cognitive part helps people recognize thought patterns that make them feel anxious. A therapist will help the person figure out what they are thinking and then show them how wrong they are. The behavior strategy figures out the dangerous situation, and then the therapist makes a plan to help the patient deal with it. It helps you get over the fear of facing your fears. 9. Don't let it change your life. When someone has a lot of anxiety attacks, they might stop doing normal things to try to make themselves feel better. They might stop going to the doctor because they're afraid they'll find out they have cancer, or they might not go to Orlando because they heard an alligator attacked someone there last year. People who have panic attacks may start to avoid certain situations out of fear that they will make them have one. When the anxiety becomes too strong or lasts too long, it is important to get checked out. It's hard to find a good therapist. The American Psychological Association gives advice, and the ADAA lets people look for therapists by zip code and area of expertise. If you're looking for therapy for your child, ask if you'll be involved. 20. Consider alternative therapies. Not everyone can see a therapist or feels comfortable talking to one, but there are other ways to get help. Dr. Sherrill says that bibliotherapy, which is reading that is meant to help ease mental pain, may help parents of kids with anxiety or people with mild anxiety. Apps like Anxiety Coach, Headspace, and Pacifica are also used to treat anxiety. Be a good customer and check the app's history to see if it has been tested to make sure it works. You should choose your app like you would choose your therapist. Teletherapy is a way for people who can't physically get to a therapist to work with one through video conferencing. Teletherapy is another option that is easy to look into. So, that's it for today. If you still have questions, please leave a comment below and our team will do its best to address them as quickly as possible. You may get all the latest information by pressing the bell icon and subscribing to our YouTube channel. Thanks for watching.